One of Flibe Energy's key goals is to supply the world with vital isotopes needed for life-saving cancer treatments, specifically the ones required for targeted alpha therapy, one of the most promising cancer treatments today. Targeted therapies have proven to be extremely successful. Unlike chemotherapy, which can affect the patient's whole body, targeted therapies specifically seek out cancer cells and destroy them with chemicals or radiation on a localized level. One particular type of targeted therapy involves attaching radioactive isotopes to antibodies. Once injected into the patient, these antibodies circulate through the body and bind to the cancer cells. The isotope then decays, sending a particle through the cancer cell, destroying it. There are two main types of radioactive isotopes used in this type of targeted therapy: alpha-emitting and beta-emitting. Beta-emitting isotopes are common in today's treatments, but alpha-emitting isotopes are showing a lot of promise to far exceed them in treatment success in the future. Known as targeted alpha therapy, these treatments can destroy cancer cells with a much higher level of precision. What makes them so effective is that an alpha-emitting isotope releases an alpha particle that travels a very short distance, only the length of about 1 to 3 average-sized cells. This focuses their destruction to an extremely localized area, killing the cancer cells while limiting damage to nearby healthy tissue. They also pack a lot of cell-killing power by releasing a high level of decay energy. So just a few particles are needed to destroy a cancer cell. In contrast, beta particles travel much further, averaging a travel distance of about 30 to 300 cells. So their area of destruction is much larger than that of an alpha particle, which only travels a fraction of the distance. Beta particles also create far less decay energy. This means that hundreds of beta particles are needed to kill a cell. As a consequence, beta particles cause far more damage to nearby healthy tissue than alpha particles. The ability to target and destroy cancer cells with such precision is the reason why targeted alpha therapy is one of the most promising forms of cancer treatment for dispersed cancers, like leukemia and lymphoma. These therapies have already shown incredible results. In one terminally ill patient, small tumors throughout their whole body were completely destroyed with targeted alpha therapy. And numerous cases around the world have had similar outcomes. So, with such amazing results, why aren't these treatments being used more broadly? The answer to this is simple. The necessary alpha-emitting isotopes are in extremely short supply. We only have enough in the global supply to treat a few thousand patients each year, when we should be treating hundreds of thousands of patients. The short supply has greatly slowed research in the field as well, which has virtually halted the expansion of these therapies to treat a broader spectrum of cancer types. The only way to change this is to develop better and faster ways to produce these alpha-emitting isotopes. This is where Flibe Energy comes in. Our reactors will grow the supply of thorium-229, which in turn will generate the necessary alpha-emitting isotopes for these life-saving cancer treatments. The increase in the production of these isotopes will also propel medical research and take us into a new age of cancer treatment. To learn more about Flibe Energy, follow us on LinkedIn or visit us at flibe.com.